So I know I'm pretty late in acknowledging Chadwick Boseman's untimely passing back in August of this year in 2020. When word got out that he passed and he had been treated for colon cancer, I knew I wanted to do an episode on that because his untimely death really hit home for reasons that I'll get into shortly. And I do know that a lot of people mourn his death for a lot of the right reasons. First off, he was only about 43 years old at the time of his passing. And, he seemed like a very likable guy, and he was a great actor with his portrayals as Jackie Robinson, James Brown, and his biggest role as T'Challa in Black Panther. So I read an article that Reuters ran in which they cited, he was diagnosed with stage 3 colon cancer back in 2016, and unfortunately it progressed to stage 4 in 2020. And to give you proper context of what that means, stage 1 is the low end of the spectrum, and stage 4 is the absolute worst stage of cancer, meaning in a lot of cases it's incurable and it's probably going to lead to death. So why does this hit home with me? Well, some very fundamental reasons. A few years back, my mother died of colon cancer about a week shy of her birthday, which is in October. And here's the backstory. So leading up to that, back in January, she passed. My mother had been complaining about, stomach pain and frequent urination. And my thought was like, hey, we gotta get you to the hospital. It sounds like a bladder or some type of urinary infection. So we should go to the hospital like right now. And I base that not because I'm any kind of a medical professional, which I'm not, but I do recall on several occasions that my female friends have had, different kinds of infections in the past. And one of the symptoms was the urge for frequent urination. So long story short, I pick my mother up, I get her to the emergency room. They evaluate her, they run some tests, and then the bomb dropped. They tell me she has this huge, massive fist-sized cyst. And from what I remember, it was pressing against, other organs in her body or in her midsection, making her use the restroom so frequently. So that was the reason why. So later on, they did surgery. They removed the cysts. And while she was recovering, things got worse. Like maybe 3 weeks to a month later, she had symptoms of nausea, pain, loss of appetite, uncomfortable bathroom visits, etc. And so now we're back at the doctor, and they ran more tests, and the next bomb drops, and she had an aggressive form of colon cancer that spread to her liver. And why? Well, as the doctor explained, thieves go where the money is, meaning our liver is a vital part of our, of our system, and cancer cells will attack healthy areas where they can thrive. So over the next 7 months, I took her to chemo treatment, radiation, ER visits where her symptoms were getting worse. And it ruined her appetite. It made her vomit. It caused weight loss and irritability. And at one point, the treatment seemed to be effective in fighting the spread of cancer or some of the cancer cells, but ultimately, my mother lost the fight. And so I'm sharing this story and I'm connecting it with Chadwick Boseman for a couple of reasons. The first one is that people may not have an idea of what this disease looks like if they aren't a medical professional, or perhaps, they've never had to care for somebody who had this disease. And things like this really strike a chord when the unfortunate news of people we know and admire, like celebrities, battle these kind of diseases. So second, I want to urge people in looking at their own risk and for their loved ones, and just based on that, really get screened. And I think the American Cancer Society and perhaps the American Medical Association recommend getting screened by a doctor starting at the age of 45, especially if you have family history like I do with my mother. And so I'll share some data in a minute, but like, please hear me out. So without me getting too graphic, this is an ugly, ugly disease. It's horrible. And caring for my mother and seeing the disease take her was the hardest thing I've ever experienced. So sitting, with her in these chemo treatment facilities, watching her and other patients being treated was fucking sobering. And watching her deteriorate, man, it was just brutal. And I have regrets. I wish our entire family, myself included, was more educated in the effects and the risk. And even as a younger man, I wish I could have said, like, hey, Ma, doctors and science are saying you're at risk for this disease and we should get you checked out and get you screened. And, maybe if we could have detected this disease maybe 5 or 10 years prior, maybe it could have made a difference. Like, we'll never know. So with that, let me share some numbers I pulled from the American Cancer Society's website. And I'm thinking it's like, I want to say it's the third most common form of cancer for men and women in the US. For the year 2020, there were over 104,000 new cases of colon cancer and about 43,000 new cases of rectal cancer. They cite the overall risk of getting colon cancer as 1 in 23, or about 4.4% chance for men, and 1 in 25, about 4.1% chance for women. Again, 1 in every 23 to 25 people will get this, basically. So it's also the third leading cause of cancer-related death for men and women. By the time 2020 closes out, and we're in November right now, they expect more than 53,000 deaths. Now, things that put you at risk, according to the science community, are, of course, family history, alcohol, obesity, inactivity, bad diet, high consumption of red meat, cured meats like, your bacon, salamis, prosciutto, like all the tasty cuts of meat that's hard to quit. So now let's talk about screening, regardless of your age. Even if you're, I would say, in your 20s or your 30s and beyond, if you're fortunate enough to have medical insurance or access to a doctor, like, ask him or her about your risk for colon cancer. On the low end of screening, you can have a conversation with your doctors, about what to look for in terms of symptoms, or, which is something I personally do every year with my doctor since my mother had it. I have to treat myself as if I'm at risk. And another thing I've done is use one of those at-home tests where you get a melon test from your doctor. You take a simple sample of what, and then you mail it to a designated lab where, they will test your fecal matter to determine if there's any abnormalities. So I've been fortunate to be clean. The most in-depth screening that I and 2 of my sisters have had is what's called a colonoscopy. So let me try to describe what that process is. So basically, a specialist in this area, which is a gastroenterologist, will sit down with you, go over your family history, your diet, your weight, your lifestyle, and if they deem necessary, they'll schedule a colonoscopy. So to prepare for the colonoscopy, you're basically fasting for about 24 hours, along with ingesting a liquid laxative to clean out your system or clean out your bowels. So everything is clear prior to the procedure. During your fast, you're allowed water, like light-colored stuff like sorbet and gelatin. So, but the thing is, they want to be able to see inside of your colon when they perform the test. So here's how, and this isn't nearly as scary as it sounds. Know how your plumber inserts a long tube and snake in your kitchen when it's blocked up? Well, they're basically gonna do that, but they're gonna gently enter a small tube with a camera at the end of it through your anus. And then the doctor is gonna look through your colon, just like snake his way through, and look at your colon on a monitor that shows the voyage of this camera. that's inside of you. But don't worry, it's like you'll be completely asleep and completely unconscious during this whole procedure. And let me tell you, it was some of the best sleep that I've ever had. Coincidentally, I think it was the same drug, that Michael Jackson allegedly used, which is called propofol. Sometimes there are little growths on our colon called polyps. People, have in their colon. A polyp is basically a small growth or tissue growth that sometimes have the potential of growing and becoming cancerous. In my case, in the case of one of my sisters, we had a very small one, which our doctor removed during the colonoscopy, the procedure. The reason why is that the doctor doesn't want that little polyp growing and becoming cancerous in your later years. So I was surprised I had anything in mind personally. Like I eat pretty clean, and I went roughly 20 plus years without having any beef or pork. And regardless, I'm glad that they caught it. And I think I'm actually due for another one, another exam this year. So with the numbers, again, this is from the Cancer Society. And in 2020, like 12% of colorectal cancer cases will be diagnosed in people under the age of 50. And rates have been increasing since I think the mid 1980s in adults, ages like 20 to 39, and in the mid 90s in adults ages 40 to 54. But the steepest climb had been with younger people. I don't know exactly why. Maybe it's diet, maybe it's the environment, or who knows what the other factors are. So to drive this home, please get screened annually, especially for Black people. We are the highest segment of race at risk according to the CDC, followed by white people, then followed by Asians, if I'm not mistaken. And I have to encourage you to press your doctors. If you feel like they're not being diligent, or they're being lazy, or if they're not taking you seriously. I've seen my fair share of medical fatigue and indifference when it comes to treatment. This is your life, and your health is at stake here. So if you have elder parents or loved ones, and it may take you to advocate for them or push your loved ones to get screened. So last thing I'm gonna do is I'm gonna tag one of my former guests. Her name is Dr. Jen Caudle. Maybe you've seen her on Dr. Oz or Steve Harvey Show or Tamron Hall or on Fox. But if you have further questions, I check out her social media and hit her up, and check out her YouTube channel. I'll put it in the description. She's never treated me, but she seems like quite sharp and very well informed. So I would hit her up with your questions, check her channel out, subscribe to her. But I can't drive enough, man. Call your doctor, see your doctor, insist. I mean, if you're already there in the office, you might as well ask as many questions as you can and get them to check you out and get you treated, whatever the appropriate level of treatment is. So that's what I got for you to tease the next episode. I'm going to talk about everything that bothers me about the media industry. And this is coming at a time where there's much coverage of the presidential election, the way they've treated media coverage in the last 4 years, the coverage of racism and hate. I'm going to go into some things that I like to see change, essentially. And chances are you may have some desires about how media changes to your liking as well. So that's what I got for you. Thanks for tuning in. Hope to see you more. Spread the word if you like the content. Share, subscribe, all that happy stuff on YouTube and other audio streaming platforms like Apple, Google, Spotify, Stitcher, TuneIn. So that's it. Be safe, be well.